acute bacterial skin and skin structure infections, or I will just shorten it to ABSSSI, as we like to lovingly call them. They can be quite notorious to treat just because by definition, so those were reclassified a little while ago, but by definition they're usually comprised of cellulitis or some of their major abscesses, and then also have a measurement of like 75 millimeters square. So like it is a guidance, but it is when you think of it, that's very abstract when you're trying to figure out how your patient meets those criteria with that. So it is very difficult to figure out how the scope of cellulitis without trying to look at like, oh, how much it's spread and everything else. And the other thing that in ID we love is source control. So not having a particular source that I can like maybe evacuate an abscess or something like that, it's very important. So it's very elusive when you have cellulitis, because I don't necessarily have a source that I could be like point to and like that is it, that can take care of everything. So that can sometimes be difficult to treat. A lot of the times the patients that I see come back because they're prescribed oral antibiotics for a skin and skin structure infection, but they end up coming back and needing to be readmitted for in the inpatient setting for IV antibiotics. And I often wonder that if maybe it's not the actual antibiotics failing, because that's what they're classified as. It might be time that we came out with a new guidance by the FDA, but maybe time that we restructure some of the ways we have the algorithm of treatment for these patients. So maybe identifying some patients that would qualify for IV treatment up front, and maybe it's one dose, or maybe it's more than a couple of doses, and then we can prescribe them oral antibiotics to finish the treatment, versus giving them an oral antibiotic and maybe they needed a little bit more help than that, and then they get readmitted, the hospital gets docked, and then as well as the patient care, we run out of a little bit of options that we have.